So that's a massive question, and I think I'd address it by what I hope it will look like. So the first thing to say is a lot more emphasis needs to be placed on prevention. So at the moment, most massive increasing burden on the NHS, things like diabetes, heart disease, other things which can be prevented. So a big emphasis on working with other partners to prevent ill health in the first place. Beyond that, in terms of health services, I would expect to see fewer large centres covering every specialty that you can think of 24 hours a day, 365 days a year, and then a range of what we've previously called polyclinics, but smaller centres, some offering inpatient care, but many more offering care on a more ambulatory basis. And in terms of the sort of primary care structure that we have at the moment, I think in the future they'll have to work in bigger structures than many do at present, certainly in London. It is very difficult. People have very, very strong views, but often those views are based not on the evidence that can be put in front of them. So I think one of the things we have to concentrate on is being much more explicit about the performance of healthcare services and even individual clinicians' individual services. So putting more evidence into the public domain would be one thing that we can do. Second, as we've shown in London, if you have strong clinical leadership, often clinicians can persuade and inform the general public better than any manager and certainly better than any politician. On top of that, we've found that even those things that are contested, if you can produce an evaluation afterwards that demonstrates that actually there has been an improvement, then you can use that as a platform for making other changes. So the changes we've made in stroke care in London, the evaluation of that has acted as a platform for similar changes around cardiac care, vascular care and trauma care.